Afternoon, everyone. I'm Brooke Lovelace with the Iowa Developmental Disabilities Council. We're excited here to have Danny with HIRTA to talk about their Health Connector program that helps folks get access to healthcare appointments. So we're excited to hear more about that. Just a couple of quick housekeeping things. There should be an interpreter, Dana, who's here with us today, pinned for you. There's also closed captioning. If you hit the three little buttons on the bottom that said more, that should be able to turn on the closed captioning for you. We are recording today's session to share with other folks that couldn't be here with us today. And we think that there should be plenty of time for questions for Danny after he's done presenting. So with that, I think, Danny, I'm going to turn it over to you.
All right. Thank you, Brooke. And of course, thank you for having me today. Thanks for joining us to learn more about HIRTA's Health Connector. So a little bit of background. This initiative is designed to meet the diverse needs of various populations, especially those in underserved communities, to access healthcare services. So our goal with Health Connector is to streamline the process of scheduling healthcare appointments and arranging transportation, just to ensure that every resident has enhanced and equitable access to healthcare. So HIRTA provides service for anyone for any reason. But Health Connector provides an emphasis on groups such as individuals with disabilities, people with low income, older adults, veterans, and those with limited English proficiency. So the Health Connector just kind of reflects HIRTA's mission of ensuring that no one is left behind in accessing these essential services. So we're excited to collaborate with Dallas County Hospital to broaden the impact of Health Connector and really make a difference in the lives of those who need it most. But our aim is to, empower these individuals to navigate their healthcare needs with greater independence. So we'll get started here. So the pilot for the Health Connector is funded by the USDOT's JPO ITS for US program. And the goal of the USDOT's program is to identify ways to provide more efficient, affordable, and accessible transportation options for those underserved communities. And then expansion of these future projects will be funded through other opportunities. For example, the Story County, we are in the process of expanding to Story County, so that's very exciting. And then I'm sure, as most healthcare staff knows, if we have any healthcare staff, transportation is listed as a major barrier in accessing healthcare. 39% of survey respondents said they have missed at least one appointment due to lack of transportation. This is obviously a major issue and one we hope we can help with. But really, if you're looking at any of the social determinants of health, transportation is one of, if not the biggest barrier. So that 39% is very jarring, but that's what the Health Connector is trying to do. And of course, we track all of the missed appointments and the impact that this has had on people. So here's a look at Dallas County's older adult population or underserved population. The older adult population grew 12% from 2000 to 2010 and is expected to double by 2030. The overall growth really just it represents a shift from it expanding from an agricultural to a suburban community. But such challenges require us to utilize the available driver and vehicle resources in the most efficient manner. But this diagram shows the distribution of underserved populations. So you see there that the largest chunk is older adults at 11.8%, persons with low income 5.7%, veterans at 5.8%. And then LEP at 11 and persons with disabilities at 7.6. And that's just in Dallas County. That's where the Health Connector started. So that's just a glimpse of why this program exists and what we're trying to solve. So as part of the collaboration with Dallas County, we also introduced this dedicated kiosk here that you see on the screen. It just looks like a kind of just a self-serve kiosk there right at the hospital. This kiosk offers a convenient and accessible way for individuals to book their Health Connector trips. It is screen reader friendly. It's available in different languages. But eligible users can um, hop on here, enter their account details, such as like their phone number, however else they typically book. They would be able to put in from their origin is going to be at the hospital since that's where the kiosk is located. But then people can still use the HIRTA On Demand app or the web portal. However, for those who don't have mobile data or already at the hospital and need a ride home, this kiosk definitely is an efficient and easy option for people to use. So here's what this kind of looks like. This is the booking kiosk page. So as I mentioned, the origin is Dallas County Hospital. Then you would just put in your address. You would type if you have any guests or if you have a personal care attendant or if you need a wheelchair accessible vehicle. All of HERTA's vehicles right now are 100% ADA accessible. So that anybody can ride. If you have a wheelchair or other mobility device, that is no problem. But we're going to take a look at the kiosk and how that works. We've got a brief video. I'm going to reshare actually with sound. So this is how the
To book a
app
ride,
works.
first be sure you're registered as a Health Connector rider. Then, select Book a Trip. Enter your name, phone number, and email. Make sure this matches what's on your HIRTA account. Select your destination. The origin will always be the hospital. Enter any notes, add guests, or personal care attendant. Click Next and your ride will be automatically scheduled. To check a previously booked trip, simply input the same details you entered to book your trip. Click Next, and you will see your estimated pickup time. It's that simple. Now, get ready for your ride.
So it's very easy
To
to
book
use, and we've had a lot of folks give positive feedback about it. In addition to, of course, the streamlined booking process, we also introduced NaviLens technology, both within the hospital and on HERTA vehicles. So NaviLens is a navigation system that's designed to assist visually impaired individuals in navigating these public spaces with ease. It utilizes colorful QR-like codes, which you'll see here in a minute, but these can be scanned from a distance using your smartphone, and you don't need to, you know, focus precisely. It's as simple as taking your smartphone with this app and scanning around. But once scanned, the NaviLens app delivers audio feedback about the locations, directions, and other relevant information. And NaviLens is widely used in public transportation, schools, medical facilities, on products, and just various other places to enhance accessibility. But NaviLens offers a straightforward way to receive this real-time orientation and guidance. But with NaviLens, there's NaviLens and then there's NaviLens Go. So the NaviLens app is specifically designed for individuals with low or no vision. And this provides navigational assistance. NaviLens Go is intended for a broader audience, including those who are not visually impaired. Both of the apps use the same NaviLens code. They just differ in their features based on if you need the extra accessibility. But NaviLens Go enhances the overall experience by actually offering text and interactive features. So this makes it a valuable tool for anyone looking to explore and easily find their way around the hospital. And while NaviLens focuses primarily on accessibility, NaviLens Go actually enriches the user experience to provide interactive elements beyond navigation. So it'll show you arrows on the phone, like where you go. It'll provide you more information. But while NaviLens and NaviLens Go serve different needs, they do work together to make spaces more inclusive and informative. And regardless of whether or not you are enrolled in Health Connector or Ride HIRTA, anyone can download the NaviLens or NaviLens Go app from the App Store or Google Play to take advantage of these tools. But I will show here what the code looks like. So on the left here, you see a HIRTA writer, and I'm actually going to pull my NaviLens app up. I'll be able to see what it looks like, but you will be able to hear. So I'm going to just scan the code on my computer.
Reception, 12 inches away, right.
So it actually tells you exactly, this one's a little different because I'm 12 inches away from my computer. But here you see the HIRTA writer and her service dog, Wishes, who kindly helped us test the NaviLens code. She is visually impaired and relies on her smartphone for navigation. She uses her screen reader. But using NaviLens, she was able to enter the hospital and navigate throughout the hospital. So at the entrance here, she scanned the area with her phone. She simply downloaded the app, scanned the area just simply by going like this, and it actually identified various locations such as the reception, waiting room, women's bathroom, and then so here she selected the women's bathroom option, and then the app actually provided auditory directions and distance information. So when she was actually standing in the lobby, it said women's bathroom 30 feet on the left, and it would, as she would walk, it would go 25 feet, 20 feet, 10 feet on your left, you've arrived. And we've received excellent feedback from her and really just how important this technology is. When she shared that she frequently gets lost in medical facilities. So NaviLens is a game changer for her. And then on the right there, you see a NaviLens code at the Dallas County Hospital. So the colorful square represents the NaviLens code. And then the bottom section includes the HIRTA logo, a traditional QR code linking to useful Health Connector resources, the Dallas County Hospital logo, and the NaviLens logo. And then we'll discuss the Health Connector links in more detail later. But then there are two NaviLens packages available. The first is the free NaviLens kit, which is provided to medical facilities, libraries, schools, and other associations. These kits contain common areas such as restrooms, waiting rooms, elevators, and more. And the free kit is available at no cost. However, the content cannot be fully customized. So the Dallas County Hospital is using the free codes as shown there, well, in the previous slide. Otherwise, the second is the paid NaviLens package, which offer multiple customization features and unlocks a lot of customizable features to tailor the codes to specific needs. So with NaviLens codes, you can customize the text information. So for example, if I were to scan this one,
16 inches away, HIRTA bus 7667, press the show more.
So that actually reads out that this bus is HIRTA bus 7667, so you know you're getting on the right vehicle. So we were able to customize that. You can also personalize the audio feedback, which is crucial for visually impaired users, as it allows for clear and precise information. But you can also customize the audio to include different languages, different voice tones, or specific sound effects. And you could also change the visual design of the code as well, and enhanced interactive features, geolocation data. But HIRTA uses the paid NaviLens codes on our buses so the riders can scan the code and receive real-time information about the ride. And then just here's an image of the NaviLens locations for the women's and men's bathroom at Dallas County Hospital. And these codes can read and differentiate from these codes from up to 60 feet away. So it's very intuitive, it's very user-friendly, and like I said, it can reach up to 60 feet away. So if you're standing in the lobby, you can easily find any of these signs. Onboard Health Connector vehicles, we've also installed an infotainment system that allows us to create and manage presentations in real time. Currently, the system displays an overview of the Health Connector, a presentation about Dallas County Hospital, and just messages from Dallas County Public Health that we worked to collect from them and put into this presentation. And we will continue to collaborate with partners to incorporate their messages as well. Additionally, the infotainment system features GPS triggered events. So it allows specific media to play when the vehicle enters a designated area or zone that we would set up for throughout geolocation. But this capability allows us to tailor messages based on location and provides opportunities for advertising. For instance, if a local restaurant or a grocery store is running a special, we can set up the system so that the ad appears on the screen when the bus is within a certain distance. And the same goes for any clinics or any certain messages that the hospital or public health wants to display. So to be eligible for Health Connector trips, riders must complete their registration process. This can be done online through our website by calling us at the Dallas County Hospital or with the assistance of the Dallas County Health Navigators. And it just asks for basic information such as rider's name, email, phone number, whether they live in Dallas County. Then we collect optional information to help gather data for our Health Connector. And it's important to note that living outside of Dallas County or not identifying with any of the target populations does not disqualify anyone from riding the service. So for example, you do not have to be enrolled in, like you do not have to be registered as a Health Connector to take part of the kiosk. But if you register through us, it provides more of a individualized experience. I offer training to anybody who needs it to really take control of and use the most of Health Connector. Okay, so the EHR dashboard or electronic health records. Throughout the Health Connector project, we've been fortunate to collaborate with some really great partners. One of these partners developed a system that integrates seamlessly with the hospital's EHR. And this integration provides HIRTA and hospital staff with access to a dashboard that you see here on the screen, where you can verify, where the hospital staff can verify whether a patient has a trip booked. So if a trip is not scheduled, the hospital staff can actually book the transportation for the patient right in our app. And I'll provide more details on that system later. But the dashboard is also really valuable in monitoring situations where patient might be running late for an appointment. Hospital staff can actually get in this dashboard, see if a trip was scheduled, and determine if there are any delays with the ride. And I just want to emphasize that there is no medical information stored in the dashboard or is required for booking a trip. This is just a way for HIRTA and the hospital staff to communicate to make sure that if this Jeremy person here on the screen does not have a trip booked, that they can actually book the trip for him using our scheduling software, or we can also see, whether this person needs a ride, if this person's booked, if this person canceled, if the trip is delayed, etc. So here's just a brief overview of how riders can schedule their trips using the HIRTA On Demand app. First, they would create an account if they don't have one already, and then they would enter their pickup and drop off locations, schedule your ride by choosing the depart at or arrive by option, and then select the ride option that works best for you. And then as part of HIRTA's commitment to inclusivity, the HIRTA On Demand app supports multiple languages, as well as being screen reader friendly. And the online booking portal offers 133 languages through Google Translate. So there's the app portion. And then here is an overview of how riders can schedule their trips using the online link for HIRTA On Demand, which is available directly on our website. But the process is similar to using the app. You just start by creating an account or logging in. Then you enter your pickup and drop off locations, choosing your time with the depart at or arrive by, and then you'd finally select and book the ride that best suits your needs. And here are just some additional steps on how to schedule through the portal. Otherwise, we're going to explore how rides are scheduled on the back end. So this is how HIRTA books rides for our riders. Additionally, Dallas County hospital staff have been trained to schedule rides for patients as well, kind of like I was just talking about. And it's worth noting that HIRTA's ride booking platform for the healthcare staff offers a limited view, and it doesn't display all the riders' information and private information. So there's no exchanging of private like rider data or anything like that through the EHR dashboard or through the HIRTA's end when booking a ride. It's very limited view. It just allows the hospital staff to find the rider. If, for example, if they are at the hospital, they can actually just book their transportation directly with them. But to start, you just use the link to HIRTA's ride booking platform to search for the rider and access their profile. And then, so for example, this is our rider profile. Here you can view the rider's contact information, their ride history, and any future rides scheduled. So you see here we have the ride history and then future rides. And then the hospital staff would book a trip to book a trip for the rider, they would select book a ride, search for the desired ride, enter the necessary details, including pickup and drop off times, as well as the origin and destination. And then they would select the funding source. This might be access to care, the rider's payment information on the account, or payment due upon pickup. And then they would get the proposals. You might have pickup proposal. You might have no availability or waitlisted for a recurring trip. So the pickup proposal, you'll receive proposals with a 20-minute pickup window. This would so you just fit which one or pick which one that fits your schedule. Otherwise, if there's no availability, you just have to kind of play around with the time if there's no availability. And in such cases, it might be necessary to schedule the ride for a later time or a later day, or just call us for on-demand trips. Or you might get waitlisted. So if the ride is a part of a recurring schedule, it might be waitlisted, so the rider will be contacted up to 24 hours before the ride if there's a change in the ride status. But that's just how the Dallas County Hospital staff can actually go in and book rides for patients if they have appointments. So that kind of concludes the overview of Health Connector. I've tried to cram about 3 years worth of work into 20 minutes. But for more information on Health Connector, you can visit the www.transithealthconnector.org. Or for more information about HIRTA, you just visit www.ridehirta.com. But certainly not least, is the Health Connector link tree that I mentioned. This is the QR code on the NaviLens signs. We also use the link tree QR code on marketing materials. But this link tree houses links for everything a writer needs to get the most out of Health Connector. So it includes links about the Health Connector, about HIRTA, about NaviLens, and links to download those apps, as well as Dallas County Hospital and Mercy One patient scheduling. So if they were using this this link tree, they would be able to book their ride and download the NaviLens and schedule their appointments right here if this is the route they wish to go through. But this pop-up website provides writers a one-stop shop for everything they need for a mobility experience from beginning to end. So thanks for letting me go for a while. If you have any questions, I'd be happy to answer them, but otherwise.
Thanks, Danny. Did anybody have any questions for Danny? And you can put them in the chat, or you can also raise your hand. Danny, while we wait for that, is there any plans to expand this on to other areas? I think at one time it was mentioned that Story County might be in the works.
Yep, Story County is in the works. We're working with McFarland. We actually just received a grant for that not that long ago, and we're in the beginning stages of bringing that to McFarland and Story County. It'll be across their clinics once we figure out which clinics that they want to test it on. But otherwise, we are always looking for grants to expand this in other counties. And I will also mention that part of the Health Connector is replicability. So we have actually published all the codes to the EHR dashboard, and basically all how to. That's just open to the public for anybody to use on GitHub. So other transit systems can take that and adapt to their transit systems. But yeah, we want to continue to grow this across Iowa, and really just bring this mobility experience to across the nation. So that's part of it was the replicability.
Last call for questions or comments. Well, Danny, I'm not seeing anybody. You did such a great job presenting that I guess everybody's got all they need.
Or they're just sick of me and want me to stop talking. That's fine too.
Or they're busy eating their lunch and can't ask a question. That might be it. All right. Well, thanks, Danny, so much for sharing this information with us today. It's been very helpful for folks.
Of course. And then if anybody does have any questions, of course, there's a website, the generic health connector at ridehirta.com. Otherwise, Brooke or Emily can share my contact information if you want
Absolutely.
one-on-one questions.
Great. All right. Have a good rest of your day, everyone.
Thank you so much.